My name is Mark Hannay. I'm director of the Metro New York Healthcare for All campaign. We're a citywide coalition of community groups and labor unions that were founded in 1993 to fight for fundamental health needless illnesses, suffering, and the premature death of Americans. 45,000 every year, just so they can make profits for their Wall Street investors. We say to the American insurance industry, the imperative of a public option, other aspects of reform are important to New Yorkers. These concern making sure that premiums and out-of-pocket costs are affordable if people and businesses are going to be required to carry coverage. It includes making sure that legal immigrants can benefit from reform, just like all other tax-paying Americans. And it includes funding reform through progressive taxation instead of taxing workers' health care benefits or comprehensive health plans that are required by people with serious illnesses. Several of our speakers will speak to these issues today in more depth.
Hello, my name is Dr. Bill Jordan, and I'm a member of the National Physicians Alliance. I'm here today as a doctor and an American. My father came here as a refugee from Eastern Europe and worked for the same company for 30 years. His job supplied health insurance for our whole family. That's something that families can't depend on anymore. Healthcare is too expensive for many companies and too costly for patients. I'm a family doctor and a preventive medicine specialist. Let me tell you about one of my patients. She works long hours as a home health aide so that she and her husband can support their family. She's in her 50s, an age when health problems creep up on many Americans. She has high blood pressure and diabetes. Even though she works in healthcare, she doesn't have good insurance. She can't afford her medicine, so she takes it every other day instead of every day. To save money, her family moved out of the city. Now she commutes 2 hours each way. We should make quality, affordable healthcare available to all of us. The proposal from the House of Representatives is a good start. We need new regulations to end the bad behavior of private insurance companies. We need a health insurance exchange to provide real options for staying healthy. We need a strong public option in this exchange to compete with private insurance companies on quality. Health reform cannot wait. It will not wait. President Obama, 500,000 doctors want what is best for their patients. We support you in the fight for a healthier future, including a strong public option. When you go back to Congress, deliver a prescription for us. We want quality, affordable health care for all, and we want it now.
Good evening. District Council 1707 represents 25,000 members in the nonprofit industry in New York. Stands behind President Obama in his quest to fight for government-run public options.
Good evening. My name is Jenny Rajewski. I'm the Health Advocacy Coordinator from the New York Immigration Coalition. I'm so happy and so proud to be here tonight with our HCAN partners and to show immigrant support for health reform. The New York Immigration Coalition and our nearly 200 member organizations around the state work every day with the immigrants and their families who make up 2/3 of the residents of New York City. We call on the President and Congress to enact health reform that not only includes the public option, but that includes everyone who lives here.
Yes.
Immigrants are our family members. They're our friends and neighbors, our children's classmates, our co-workers, our community members, and they want to be healthy. They want their families to be healthy, and they want the opportunity to buy health insurance that they can afford, just like everyone else.
And this day, October 20th, is our National Day of Action, not just for Healthcare for America Now, but also for Organizing for America. And so there are phone banks, press events, rallies, speak-outs, thousands of events happening right now all across our country. This is just one. And we've got the guest of honor. President Obama is here in New York City. We're so grateful to him for his leadership in healthcare reform. And now our message from Healthcare for America Now, not just to President Obama, but certainly to our Congress.
So we need reform. We need to stick with the president. We need to and insist on a public option.
It will only pass to the extent that we work hard enough and we make it a reality. I mean, this is a moment that is a turning point in the life of this country, whether we're going to fix a broken system or we're going to continue with a system that is costing people's lives and many, many employers and workers their money. So I trust that we will do we're going to have a bill. It's going to pass. But we need to make sure that it happens, and that's why we need everybody out on the streets, talking to the elected officials, talking to the press, making sure that your voices are heard.
For the first time in the history of our country, physicians overwhelmingly support healthcare reform. This is something I'm incredibly proud of. There was a study released last week in the New England Journal that showed 75% of all physicians support a public option. So no matter what happens by the end of this healthcare reform process, the average American can look back at this and say, historically, for the first time ever, physicians are out there on the streets, talking to crowds just like this, advocating for healthcare reform. And I'm very proud of the work that the NPA is doing for that.